Hi, my name is Michelle Holbrook, and I'm here to support the Children's Tumor Foundation. I have neurofibromatosis, and the form that I have is schwannomatosis. I was diagnosed at the age of 25 after my son was born, and I am now the age of 54. I live with this condition every single day of my life, and I continue to fight hard for the Children's Tumor Foundation. I have probably had, since the age of 25, when I was first diagnosed, about 8 or 9 surgeries, as well as radiation to help cure this condition. I live in excruciating pain every day of my life. I might not look like it on the outside because I do work out and I am an avid runner and I try to stay healthy, but on the inside I am in some excruciating pain at times. I am here to speak with you regarding NF to help our children and to help our grandchildren, to help us find a cure for this condition, because it is unfortunately a horrendous condition, and if we don't find a cure for it, then as I said, our children and grandchildren are going to continue to live with this and suffer as hard as some of us do at an older age. It does seem like the older that I get, the more tumors that show up in parts of my body. Just this last year, I had surgery on my liver area, which they removed 3 rather large tumors. And they were successful at doing that, but I do go back in a few weeks for other scans and other treatment options on the ones that are causing the issues. At this time, I have probably 3 brain tumors and about 9 to 10 tumors on my spine, as well as my abdomen, my pelvis area. I had one on my leg that was removed. Please help us raise awareness. If you are unsure about neurofibromatosis, I encourage you to go to the Children's Tumor Foundation website. Again, my name is Michelle Holbrook, and I'm here to fight for NF, and I hope you will too. Thanks so much and have a great day, and we thank you for all of your support.
My name's Minnie.
And I'm Lauren.
And I'm Patrick.
And we just wanted to share with you Lily's story today.
Yeah, so Lily is 4.5 years old, and we first met her when she was about 6 months old in China. I was working for a nonprofit here in the U.S., connecting doctors and specialists here in the U.S. with orphans and underserved kids overseas, trying to facilitate some consults for their care. When they reached out to us about Lily, they knew she had a tumor. It was growing pretty fast at the time, and they weren't sure what the correct treatment was.
And so through that interaction, we were actually able to adopt Lily in 2017. We went directly to Seattle Children's to talk to the team there about a debulking surgery. And it was risky. It was surgery. There would be a long recovery process, and the debulking surgery would need to be repeated several times through childhood and as a young woman. So we were really excited to learn that targeted chemotherapy was an option for Lily, and that actually began the next fall in 2018. We were able to get her on a daily chemo dose. In June of last year, through her routine imaging, we found out that she actually had moya, which is a disorder of the arteries in the brain, and she would need not 1 but 2 brain surgeries last summer and fall. Between them, she actually did suffer a stroke due to that moya, and so last year we spent a little over 5 weeks in the hospital with her at various times. And now the surgeries were a success, and she's been able to start her chemo again. And then we were actually started a new chemo. Lily, would you like to tell them about your chemo? You're on Kuselago.
Mom, I'm here to watch all by myself.
Yes, you do. You take your pills all by yourself. Do you swallow them?
Yeah.
Is it hard, do you think?
No.
No.
Yeah.
How many do you take in the morning?
1 or
No, you just take 2 in the morning and 1 at night. And you can't eat afterwards. That's the hardest part, right? And we're really glad that this Kuseligo medication, the side effects are very mild, and so Lily's able to do everything normal kids are able to do. You started preschool this year, right?
Oh, I love that. Mama.
Yeah, ooh, you're having so much fun in preschool.
I'm so
You
good,
have-
Mama.
You're so strong.
Okay.
How many older sisters do you have?
Didi,
Gigi and Molly and
Maggie, Mama.
no, Mama's not a sister. You have 4 older sisters that you play with, and you're just like, you know, a regular little kid. And so it's just been really exciting to see her. It's exciting to have some opportunities for the future as we look towards NF and care, and we just know that it's just going to look completely different. As she grows and changes. We're excited to see what NF looks like in her future.
Bye.
And good luck!
And good luck. I'll see you next time.
Sometimes I don't want to talk about it. Sometimes I do. Sometimes I want to talk about it, but not with you. Sometimes my head screams, I just want to yell into the void. When things get all foggy and dizzied and I can't do the things I've enjoyed. No, sometimes it's better not to tell you, because I tell you too much. I worry you'll think I'm always suffering when I'm not. Do I want someone to see what it's like being me when I'm broken, weak, and down? I'm not always the positive person that I've built my facade around. I cry real tears, I spit fire from my tongue, yelling at something I can't see or someone. No, I'm not mad at anyone. My only grievance is this. Why the hell do I just struggle with this thing I can't fix? I can pop pills for days. I can have my body sliced into. I can distract myself from seeing what I don't want to see. Though then comes the weight that rests heavy on my shoulders. I have to look you in the eye and address you with a smolder. You have no right to make my life not seem like mine. Make me hide my pain from the world and pretend that I am fine. Sometimes you're too heavy to carry and look for some help, without feeling like a burden or a victim for asking. The cruel fate is that this will never end, my relationship with you. But I'll be damned if you take away love, which is my biggest defense against you. And you won't. I won't let you. So my friends, my loves, I want you to know. Sometimes I don't want to talk about it. Sometimes I do. Sometimes I want to talk about it, just not with you. Though that does not mean that I don't love you.
When people look at me, they can't see the dozens and dozens of tumors that line the nerves throughout my body.
Something about my NF that people can't see is the pain.
How hard it is for me to pick up a new thing to learn.
Chronic pain, the headaches, the migraines.
The headaches, the depression.
I've had a lot of chemo in the past.
I've had digestion and I have speech impairment.
I fear that my fibromas, the tumors, may grow even more.
Something that people can't see about me because of NF is that I am really strong inside.
You can't see the migraines I get on a daily basis.
Something about me that you cannot see because of my NF is that I'm just like everybody else.
You can't see the stress and sleeplessness they'll experience thinking about their lives.
A left-sided brain tumor that you cannot see.
A bunch of neurofibromas around my spinal cord causing a lot of stabbing pain.
That I struggle a lot with self-esteem issues. My case is very mild compared to some people. Like I do have some bumps on my arm.
13 tumors currently growing in my brain and my spine due to NF2.
At the time of my diagnosis, all I thought NF meant was that I would eventually lose my hearing.
It takes me longer to learn a certain topic or activity like math.
Just because someone doesn't show external signs of NF doesn't mean that NF doesn't impact every aspect of their life.
Sometimes people can't see past my bumps to realize that I have the same hopes, dreams, and aspirations as anyone else.
Most people are not aware of it, especially in Nigeria. Nobody really knows about NF.
I am making NF visible because I have an amputation coming up in the next few days.
And having my back spasm from having a migraine from the tumors in my brain and back.
You know, all the clinical trials I've been on throughout my life, you know, and different medications, that kind of thing.
I can't even see my own NF. I have no idea what's going on inside of my own body, and that's terrifying.
And he was born with many Kappa-Lay marks, just like I have.
Something about my NF that people can't see are the tumors on my hearing nerves and spine.
They look past who I am as a person. They don't see me, they see the NF.
I want you to see me, and I want you to see NF.
See Addison and see NF.
I want you to see me and see NF.
So sometimes whenever I talk to someone, I have a tumor underneath my tongue and they ask me what it is. So sometimes I'm just like, I don't know how to answer that.
Sometimes I like to keep it a secret that I have NF. I want them to know that I have more tumors around my body.
I instantly say, I have neurofibromatosis. It's a genetic disorder that causes tumors to grow on my body. Would you like to learn more about it?
Because some people, like, you can definitely see that they have tumors and stuff related to NF, and some people you can't see at all.
Just because it affects my visible appearance doesn't mean it affects me on the inside at all.
It probably gave me scoliosis because I have scoliosis.
Even though I had 5 brain surgeries, I can still fight back, and I'm a strong rock climber.
My physical pain and emotional pain, and what I go through every day.
People are really good at hiding their feelings, but it's not like something that you want to share with other people because you don't think they'll understand or they just won't care.
It's hard.
Really hard when you're young. Then you really have to deal with that, and you have to deal with constantly being stared at, reminded that you do look differently.
I want people to know that I'm a little different.
I want everyone to see that everyone's different in their own way, and no matter what, you should all treat everyone the same.
I'm not freaky, I'm not weird, I'm not some alien. I'm like my other peers, I'm like everyone else. My name is Jane, and I want you to see me.
And I want you to see me.
See me.
See me.
See me and see NF.
And see NF. I want you to see me and see NF. My name is Michael Zazula, and I have NF1, and I was diagnosed by NF at 4 months old.
I have neurofibromatosis type 1.
My son Raphael has NF2 and he was diagnosed 3 years ago at the age of 4.
I have neurofibromatosis type 1.
Raphael has a meningioma between his left eye. He's blind in that eye. He has several other lesions, one that has caused his left vocal cord to become paralyzed. Besides that, he's doing amazing. He is excelling in school, excelling socially, and is the happiest, most wonderful little boy that you could ever meet.
I have the tumors and the facial disfigurement that you see. I have other tumors on my body, but thankfully the manifestations of NF, for me at least, haven't been all that severe. I don't have brain tumors, I don't have significant functional impairments except for having an amputated leg, and I do pretty well.
I have migraines a lot, I have to go to the doctors a lot, and I have MRIs a lot.
What gives me hope is seeing the advancements that I've already seen in the past 3 years since Raphael's diagnosis.
The advances in science, partly funded by this foundation, have been remarkable. The changes that are happening, the learning and the education that scientists are creating have been fantastic. I have great hope for the future that we will find advancements in treatments, even prevention, and hopefully even a cure.
I have hope because for all the hard work that CTF does. Hi, my name is Jackson, and I have neurofibromatosis type 1.
Doctors were telling my mother I had cancer until we finally found a doctor who was like, this is neurofibromatosis.
It's hard.
It's really hard when you're young. Then you really have to deal with that. And you have to deal with constantly being stared at, reminded that you do look differently. My name is Aiden, and I want you to see me.
And see NF.
Please welcome our hosts for tonight, Jonathan Sadowski and Raina Seitel in New York City, and Della Chiesa in Boston.
How we doing, everybody? Good evening, everyone, and wow, what a reminder of why we are all here tonight. My name is Jonathan Sadowski, and I am thrilled to be one of your co-hosts along with my dear friend, Raina Seitel, who is here with us live in New York, and my other friend, Della Chiesa, who is celebrating with others in Boston to honor Leslie and Dick Cates, our 2021 Humanitarian Awardees.
Yes, it is so lovely to be here with you tonight in the flesh. We are often on Zoom calls together. I look much different than I do tonight, and I hear myself echoing. That's quite scary. Yes, it is. But really, it's so great for you to be here tonight in the flesh.
I can, like, touch you.
Yes!
That's crazy.
And he's as nice as he is handsome, okay? Whoa, that was really loud. All right, we're gonna just pretend that I'm not echoing in my own
I got
ear.
you.
Okay, so we are also joined by Ron in Boston, which is oh so cool. We were virtual last year, so this year it's wonderful to be here in person with you all, and of course virtually as well. We are 300 strong here in New York City. Folks joining us in Boston and so many around the country and around the world, which is really cool. Some people are having house parties in Miami and Montana, which is great, all to help the Children's Tumor Foundation fulfill its mission of advancing research, expanding knowledge, and improving care for those living with neurofibromatosis, or NF for short.
Raina, you and I have had the pleasure of being a part of the Children's Tumor Foundation family for quite some time, and specifically this event, which we've hosted before. We've seen some life-altering advances come to fruition, including the first drug for NF to ever be approved by the FDA in 2020.
That's a pretty big deal. And so because of these advances, CTF and everyone in the room tonight in New York City, Boston, and those watching at home, because of you, we are here and making those advances. And speaking of Boston, let us check in with our friend Ron and the New England posse. Hey there, Ron. Hey there, Ron.
Hey, thanks, Raina. So good to be with you, and Jonathan. Wonderful to be with both of you tonight, and all the folks here in Boston celebrating the work of Leslie and Dick Cates. And all of our amazing honorees this year. I met the Cates just recently through my mutual friends, Norma and Dan Frank, and was immediately inspired by their passion and dedication to this great cause. And I'm just honored to be here with them tonight, all their friends, to help celebrate this wonderful occasion. Another terrific year for the Children's Tumor Foundation. You know, while COVID-19 might have kept us from being together in person, it certainly hasn't stopped us from raising money and fighting to end NF no matter where we are tonight.
Yes. And since we are here to raise money with the goal of $1.5 million, I know we can do it, I'm going to provide everyone with a few tips on how to get us closer to that goal, no matter where you are tonight. So, get those pens and papers out. All you need to do is text END NF to 41444, or go to ctf.org/gala, or you can call 1-800-323-7938. And I believe that information is also on everybody's screen right now, but just in case, one more time, text END NF, that's END NF to 41444, or go to ctf.org/gala, or 1-800-323-7938. I think I can memorize that by the end of the evening.
You got this, girl. You got this. And Ron, while we wish we could all be together, we are thrilled to be able to have you and everyone in Boston live with us tonight. What a special evening. Now, it is my great pleasure to introduce a dear friend and someone I've gotten to know over the last few years, someone who is truly fearless. She is inspirational, and she has the vision of all visions to end NF for everyone. Ladies and gentlemen, it is my honor to introduce the president of the Children's Tumor Foundation, my friend, Annette Bacher.
Only you could pull that off.
I thought to adjust a little bit. We are hybrid, right? So I thought, let me come hybrid. What an immense pleasure of being together at the end tonight. This incredible gala was pulled off by Liz, Erica, Tila, Shelley, Mady, and Clara. They have put together a Star Wars level performance tonight, and I would like to ask you to give them a big round of applause. This is, I don't know if you see, but this is 2 galas in person, one in New York City, one in Boston, and hundreds of watch parties, big watch parties. So this is, to me, the global NF connection. We have parties all over the world because we are celebrating our wins. Because, indeed, we are winning against NF. Together, in the past 10 years, we have invested your $90 million in our mission to driving research, expand knowledge, and improving the care for the NF community. Together, you invested globally, from Canada to South America, from Europe to the US. We are training the experts of tomorrow. We are educating the regulators to understand what it means to live with NF. And we are building a global clinical trials platform, data sharing infrastructures, and we are investing together in the research all over the world, from the US to Australia, to Europe, to China, because only together will we be able to end NF. The innovations that have been developed are astounding. Together, we invested in improved understanding of the biology of NF. We are building, we're in the development of new and reused drugs, in stopping the effect of genetic mutations, in replacing the gene or correcting it. We attracted gene delivery experts from Australia, hackers from all horizons, many of them new to NF. The creativity of this research community is infinite because of your investments. Tonight, you can proudly look in the eyes of your hero and say, there are so many people, there is an entire community of people who care about you and who want you to live your life to the fullest, free of NF. We have never been at a better time in the progress against NF. And there are many reasons to celebrate, but let me just give you one example. In the midst of the pandemic, we approved the very first drug for NF1. And why is that such a big deal? I don't know if you remember me saying that in the cystic fibrosis community, their first drug only helped 4% of the patients. 10 years later, they have drugs and drug combinations, and 90% of the cystic fibrosis community is helped. Why is that? I think that is because that first drug approval has raised awareness of cystic fibrosis, and suddenly everybody wanted to help. And you know what? NF is as common as cystic fibrosis. So let's fuel the movement. Let's keep growing the knowledge of NF so we understand our enemy. Please help us grow the community even more. No one with NF should feel alone. And yes, let's keep growing the revenue so that we can fund more research to end NF. And just as a proof of what a community like you is doing, hundreds of you, amazing CTF volunteers, and I'm pretty sure there is a few tables volunteers here tonight with us. There you go. Who are spending their time and their free time to make NF visible, to support each other, and to raise the funds for research. A few days ago, 150 scientists, data scientists at the American Airlines headquarters dedicated their charity day to building a data warehouse for the Children's Tumor Foundation. And that was because one incredible NF mom ignited this project. More and more companies are investing in NF. And tonight, we have the proof. It is my absolute pleasure to announce that we honor a special partner, but also a friend, SpringWorks Therapeutics. It is an incredible story, and I always say, it is a story, what you can accomplish with believers. Please watch the video.
When your child's diagnosed with NF, you feel like you've been stripped from so much control and ability to protect. So organizations like CTF, who's funding the research and guiding where the money should go, and SpringWorks, that's listening to the patients and what's important to us and trying to drive solutions, that empowers me again.
SpringWorks Therapeutics is a targeted oncology company with a mission to develop new breakthroughs for people living with devastating cancers. We're a team of people who are passionate about science and driven by the opportunity to help people suffering from these diseases live longer, better lives.
So when Ethan was 3 months old, his pediatrician suspected that he might have NF. It took us about 3 years to get a genetic test that confirmed his diagnosis, which was when he was 2.5.
When Alex was 2 months old, we noticed some cafe au lait spots on him. We asked the pediatrician at his 2-month appointment, and she suspected NF. And then about 2.5 years later, we found his first tumor.
I really wanted it to be something that wasn't associated with tumors, and that just came with these cute little coffee spots all over him, and it didn't turn out that way.
SpringWorks is conducting a phase 2b study called the Renew trial, which evaluates the safety, effectiveness and tolerability of our therapy, which is called mirdametinib, in children and in adults with NF1-associated plexiform neurofibromas. We believe that drug has the potential to be the best in class because of the availability of a pediatric formulation and a dosing schedule which doesn't require you to fast. This is quite important in children because fasting in kids is particularly difficult for them, and they need to continue their treatment for a long time to control the tumor growth.
Through our journey, we've met some amazing people, and we've really been supported by CTF and the guidance that they're showing in the field.
They advocated for drugs like mirdametinib that have been stopped in development at other pharmaceutical companies because they saw the promise that it held for patients with NF1-PN based on the available phase 2 data.
I'm not going to sit around and be idle while I let a disease eat my child away. But I'm one person, and that's not my skill set.
It takes being in it together with organizations like CTF to make NF visible and push ourselves to develop new advances for patients and their families.
I think together we can really push the field forward.
SpringWorks' commitment to the NF community is that we will work with urgency to complete the Renew study so we can evaluate whether mirdametinib can be the next FDA-approved therapy for children and adults with plexiform neurofibromas. But our commitment extends much beyond our clinical studies. We are committed to learning about the needs of the NF patient community and how we can help by providing resources and other support that will further enhance care for patients and their families.
It's companies like SpringWorks that give me hope that when I'm gone, when I can't run for CTF anymore, when we can't do any more on our end, companies like SpringWorks will create a cure for children like mine.
On behalf of the Children's Tumor Foundation, I would like to present the cape with this amazing sculpture, which is a unique piece that was made by somebody who loves us and really wants to end NF together with us.
I've already violated 2 rules: never follow Annette, never follow a patient, never follow their mom, but we're going to do our best here. So thank you, Annette, for the kind introduction, and a very big thank you to the Children's Tumor Foundation for honoring SpringWorks with the 2021 Innovation in Medicine Award. I speak on behalf of the SpringWorks team, some of whom are here with us this evening, when I say that we are very grateful for this recognition, but more so for our partnership with CTF over the years. I said this on the video, SpringWorks is on a mission to develop breakthrough treatments for people living with devastating rare diseases like neurofibromatosis and cancer. Our team is passionate about science and driven by the opportunity to help people suffering from these diseases live longer, better lives. Ultimately, it starts with patients who are the inspiration for the science that we pursue. At SpringWorks, we attempt to see the groundbreaking potential of that science and what it could mean for people without options, without treatments, and oftentimes without hope. Unfortunately, we also see that sometimes that science can be overlooked or deprioritized and is left unable to make its full impact. From the start of our company, CTF has been an incredibly valuable partner to SpringWorks. It was together that we recognized the promise of mirdametinib, which at the time was under the risk of being shelved. And we shared the same eagerness to continue studying its potential as a new medicine for the NF1-PN community. Right now, we are advancing a late-stage clinical trial of mirdametinib, which is a MEK inhibitor in both children and adults with NF1-associated plexiform neurofibromas. It's our hope that mirdametinib will be the next FDA-approved therapy for NF1-PN and one that offers patients and their families significantly better outcomes. As an advocate of advancing research, CTF has worked with us to raise awareness of our study called the RENEW trial. Their efforts have proven to be incredibly meaningful in supporting the movement of this study and the promising science behind it forward. It is the data from this trial that we hope will support an FDA approval of mirdametinib and ultimately bring this therapy to patients. So we are extremely grateful, even as we talk about these studies, for the people who choose to participate in clinical trials and their families who support them every step of the way. One of our core values at SpringWorks, we say, is to care hard, which is meant to represent how deeply, intensely, and relentlessly we care about developing new medicines for patients and their families. Now, that all sounds like a noble pursuit, and it is. But ultimately, as we unpack the meaning behind the message, all we're really trying to do is match the urgency, intensity that patients, parents, families, and other caregivers are bringing to this fight. The urgency that the people in this room have brought to this fight. Before I conclude my remarks tonight, I want to emphasize that it is the people who are living with diseases like NF that inspire what we do at SpringWorks. We have walls in our offices, if you've seen some of the pictures, covered in patient photos, each with a name. These pictures represent and remind us who it is that we work for. Each SpringWorker knows that behind each photo, there is a network of people who are counting on us to develop new treatments and to do better today than we did yesterday. Because ultimately, someone is waiting for a better solution to their life's biggest challenge. We appreciate that each picture has its own unique story behind it. A child, a mother, a father, a friend, all of whom have one thing in common, that their life was turned upside down with a devastating diagnosis. They inspire us, they motivate us, and they energize everything we do. And we thank them, and I thank you for the privilege of being in their and your service. So, to all of the NF families here tonight or tuning in virtually, you have our commitment and my personal commitment that we will keep working with tenacity to advance this important research, to listen to your needs, and to make NF visible. Thank you.
Hello and welcome again from Boston. I want to take a moment here to acknowledge the beautiful award you just saw, specifically made by Giacomo. He's a wonderful Italian artist and friend of the foundation. Now, tonight's awards are called the Cloud Carrier. What a beautiful name. The Cloud Carrier, a person that walks silently and on tiptoe, carrying the most precious thing that exists, the dream that each of us carries inside. And in this case tonight, that dream from all of us in our hearts is a cure to end NF. With partners like SpringWorks working side by side with CTF, our dreams will come true sooner rather than later. And I'm sure Annette would agree with that. To help us achieve this dream that we all have, I hope all of you will consider making a donation tonight to help us end NF and end it now. Here's what you can do. You can text NF to 4144 or go to ctf.org/gala or call 1-800-323-7938. We have people who are standing by to take your call tonight, just like in those old days. And we have volunteers in our room, both in New York and here in Boston, to help you make your donation. And let's actually call out a few donors from across the country who've already made a donation tonight, getting us closer to achieve our dreams. Thank you, Mia and Eric Coldorn, Sandra Reese, Elizabeth Caputo, Lisa and Ralph Beffincourt, Leslie Collins, Alexander Heckler, Scott Shehorn, Mary Ann Donovan, and Maria Stolfi. Let's give them a big round of applause from Boston. And now it's my pleasure to introduce a very special performance tonight in honor of Leslie and Dick Cates. Please welcome our dear friends and newly married singer-songwriters, Matthew Wade of My Silent Brewery, featuring his wife, Shauna Schwachman.
Thank you so much. How's everybody doing tonight, all right? Hope well. Privilege and honor to be here. Again, I'm Matthew Wade of My Silent Brewery with my lovely bride, Shauna Schwachman. It's really our pleasure to be here. We're going to perform a song tonight, an original song. It's called A Little Bit More, and it's about going that extra mile. I know a lot of people have done a lot of things up till this moment, up till tonight, but we can always do more, as we know, and this is a song about that, about going that extra mile. And usually when you do go that extra mile, that's what brings the extra blessings into our own lives as well, and into others, of course. So we hope you like it. It's called A Little Bit More.
Would it really be hard to find just a little bit of your time? Doesn't take a lot to be kind. When too many feel out of place, alone in this human race. Tell me why it's so hard to change. Sometimes the sun and moon, they both light up the sky. You can give a little bit more. Comes right back through your door. You can give a little bit more. You can love a little bit more. Find what you're looking for. You can give a little bit more.
Is there any other way to say the world is losing faith? Roll the dice, we're tempting fate. And is anyone even sure what we're fighting for? Was it always like this before? Sometimes it's just one word for hello and goodbye.
If you can give a little bit more. Comes right back through your door. You little bit more. You can give a little bit. You can give a little bit. You can give a little bit more. You can give a little bit. You can give a little bit. You can give a little bit more.
Thanks a lot. Let's end NF.
We're getting used to those performances on Zoom. So thank you so much, Matthew and Shauna. That was so beautiful, and what a treat to have you perform for Leslie and Dick in honor of their receiving the Humanitarian Award this evening. Thank you guys so much. Boston, if you can hear us. Thank you, thank you, thank you. And now I have the great pleasure of asking a dear friend and board member of the foundation, both in the US and in Europe, to come up to the stage for a very special announcement. Please join me in welcoming Stuart Suna.
Thank you, Raina. This is really my pleasure to be here with all of you celebrating our collective goal and efforts to end NF. My family and I are here tonight. Vicky, Rose, Zoe, Joanne, and Michelle all became involved with the Children's Tumor Foundation more than 24 years ago when my daughter Rose was diagnosed with NF1. As a child today, Rose is an amazing young woman, co-chairing the efforts of the Foundation's junior board along with McKinnon Galloway. Both Rose and McKinnon, please stand up for a second. I want to also thank all the other junior board members who are here tonight and watching virtually or in Boston. I'm so proud of you, Rose, for all that you've done and all that you've become, and watching you grow in your work with CTF. You've definitely become a young woman, so congratulations. I'm also so proud of what the foundation has achieved in the last 40 years, and I'm pleased to be able to sit on both the foundation's board in the US and in Europe to see firsthand the work we are doing to change the lives globally. It's very exciting to see how science and medicine can really come together and have a major change in life, and hopefully benefit cancer research and so much more. Since 2020, CTF has seen the first drug for NF1 to be approved by the FDA, having funded its early preclinical trials, created clinical trial testing with multiple drugs at the same time for patients with NF2, helped to launch a clinical trial assessing pain for patients with schwannomatosis, and launched a gene therapy effort. And basically, all of us, we've all been hearing about the magic of gene therapy. Well, it's real, and it's really happening now. So hopefully it will bring about real change for NF in the near future. Gene therapy's effort has been funded through the detection of MPNSTs and translated the NF registry into multiple languages, expanding our global research. Without CTF's diversified and very targeted approach to funding, NF research would not be here without all of you who are here to help us support. CTF has become a global leader and a change maker and a beacon of hope. It is with this reason I am pleased to announce my own personal multi-year gift of $1 million to the Foundation for the discovery. Thank you. Thank you. Thank you. Wow. Thank you so much. It's really through all of your additional support and inspiration that we're all here to help each other. The Discovery Fund and the advancement of NF Registry, so we can continue to fund the mission and the critical life-saving NF research. It is my hope that with each of you here tonight in New York City and in Boston and watching from your homes virtually, will join me in making a gift tonight to end NF. It is our dream to end NF, is our collective vision and our mission. And if each of us tonight makes a gift, no matter how large or how small, we'll help end NF together. And I thank all of you for all you do. Thank you.
One more time for Stuart soon, everybody. Stuart, how can we ever thank you? You know, I am so touched and humbled by the outpouring of support from you and from across the country tonight. In fact, let's thank a few of our donors who have given this evening. Do I have a card to read? Let's keep going. Great. That's show business. And ladies and gentlemen, welcome back. I'm your host, Jonathan Sadowski. Good to see you guys. I just got word that Erica Hartman-Horvitz and Rick Horvitz, here with us tonight in New York City, have just pledged a $100,000 matching donation for the next $100,000 raised tonight. Thank you guys so much. It's absolutely amazing. Your generosity does not go unnoticed. I absolutely know we can do this tonight, guys. I know we can hit our goal of 1.5 million, and here's how you can help participate in the match tonight. There are 3 ways. Ways number 1, text NF to 41444. Go to ctf.org/gala, or do it the good old-fashioned way and dial 1-800-323-7938. We have people standing by on the phone and in the room ready to help. Let's end NF together. Let's end it tonight. And wait a second. If I had an earpiece, this is what I'd be doing. I just got an announcement. You guys are killing me. Here we go. We got an announcement.
Sorry about the mishap.
No worries.
Thank you, Jonathan. My name is Sam Falic, and I'm so proud to be here tonight on behalf of my family and the Falic Family Foundation. My family has been supporting the Children's Tumor Foundation for many years and are so amazed by what Annette Backer, CTF President, and the NF researchers CTF has funded have been able to achieve to advance treatment for NF. I am proud that my family is supporting tonight's event from all over the globe, from Israel to New York, from Miami, and everywhere else. And I am proud, and honored to continue that support. In addition to the $18,000 donation my uncle Leon Falic gave and the $10,000 my cousin Doe Falic gave, the Falic family would like to match an additional $100,000. That's right. For the next $100,000 raised, your dollar will not just be doubled, but tripled. We're so proud to be here to honor all NF patients. You are our heroes. Ali G, if you're watching this, I love you. Don't tell your sisters, but you're one of my favorite nieces and my best friend. Let's raise our glasses to find cures and end NF. Thank you.
Thank you. Ladies and gentlemen, another $100,000 match. That is crazy. On top of another $100,000 match, unheard of, and I know we are going to meet this double match. That's right. For the next $100,000 raised, CTF will receive $300,000. Now, as we all recover from that announcement, it is my pleasure to introduce my dear friend, Ian Desmond, coming to us live from Florida to present our next award, the CTF Champion Award.
Thanks, Jonathan. Good to see you. Good to see your recent. The CTF Champion Award is given to someone who goes above and beyond, using their personal celebrity to raise mission-critical awareness and funds for the foundation. Not long ago, I was recognized as a champion myself. It was my friendship with Ethan Brown that made it all possible. Unfortunately, Ethan is no longer with us, but the time we were able to have together, I'll cherish forever. In addition to my relationship with Ethan and the Brown family as a whole, I've been able to do meet and greets and get to know so many other fighters along the way. All of the things I miss about baseball, none of it compares to the interactions and the relationship that I built with so many fighters throughout the years. This year's champion is Raina Seitel. For the last 5 years, Raina has been the master of ceremonies for the gala. And if you've been following me over the last couple of years, you know that this isn't my strong suit, and Raina, you make it look way too easy. And like myself, I know that Raina's personal connections with the NF community will keep her coming back for many years. Through her work as a journalist, friend, mother, CTF champion, Raina has spread awareness about our mission, helping CTF reach those who otherwise wouldn't have heard of us. Raina, I'm grateful to be the one to present you with this award. Thank you for all you've done, all you will do, and the champion that you are. Please join me in watching this short video of Raina's contributions to CTF.
Good evening. My name is Raina Seitel, and I am delighted to be here with you tonight.
CTF's cause is everyone's cause. And it is true that it might just take one more dollar, and that could be your dollar to cure NF.
When we think of our children and those who we love who are affected by NF every single day, we are reminded that they are born fighters. They don't give up, they don't lose heart, and they never give in. I should just go home. That was amazing, right? Wow, the next Judy Garland is in our midst.
On the field, Ian Desmond of the Colorado Rockies is one of baseball's greats. And off the fields, he hits it out of the park as well. We should not stop, indeed. So from the first new drug approved for NF this spring to new clinical trials for NF2, schwannomatosis, and cutaneous NF, not to mention a year of virtual fundraising events, symposiums, and educational programs as CTF advances its global vision to end NF. But the foundation cannot do it alone.
Ladies and gentlemen, the 2021 CTF Champion Award, my friend Raina Seitel.
Thank you so much. Oh no, thank you so much. This is so sweet. This is the part where I want to just hide under a blanket. I do, before I begin, just want to acknowledge Ethan Brown, who was an amazing, spirited, wonderful, compassionate, strong, brave fighter. Through the organization, I got to know him a little bit, and he was working on a book and had all these amazing dreams and goals. And so I think, like, just to remember why we're here, right? Why people give. It's because of someone like Ethan, who was incredible. And his life was cut too short. But there's so much hope. Thanks to all of you being here tonight. There's so much hope, right? And so an Ethan out there can live a life that he wants to live and dream big and write that book and complete that book. So I just, before I say my, written words, I wanted to just acknowledge you all here tonight and thank you for being here, because just being here and spreading awareness and giving $1 or $2 or $1 million, if we could dream, is really incredible. So thank you all so much.
Am I back on after this? Am I back on after this?
And so to those written words, I want to thank my dear friend Jonathan and Ian Desmond, who preceded me in receiving this amazing award. I have to say, you all should feel how heavy it is. It's so cool. They're pretty amazing, those two, and I am just in awe of the work that they do for the foundation. And you know, Jonathan tonight is just lighting up the room, and all the ladies are swooning. So you know, go say hi to him later. He'll be autographing his Sex Life series, which, by the way, is number 3 in all of Netflix sales or something like that. So, what? Distribution? Yeah, that. Anyway, he's real Hollywood and he's here tonight. But anyway, I digress. Okay, I became involved with CTF right here in one of those seats about 5 years ago at the Gala because of a close personal connection I have to the cause. And since that time, I've been so impressed, truly, with what CTF has been able to achieve year after year for its patients and the families living with NF. The foundation staff, the people behind the scenes, and the supporters, all of you in this room tonight and around the world and around the country are determined. You all have heart and you have commitment to find a cure. And it's nights like these where we allow ourselves, as I said before, to feel hopeful. Listening to Annette tell us about the major strides that CTF has made, including the very recent drug approval for NF and the advances that brings with it, I personally am determined and impassioned to do more for the Children's Tumor Foundation, and I hope you all are too. So tonight is about hope. It really is. When I think about hope, I think about the NF families and the patients who now I call my friends. Vicky and Tracy, Stuart, who you just saw, Liz, Victoria, Tammy, Anita, Laura, and of course Jonathan, Annette, and Michelle. And not to mention the most beautiful, dynamic, unstoppable duo of Rose and McKinnon. Where are you, girls? Where are you, girls? Wave, McKinnon, wave. I just mentioned you, my dear. There she is. Yes, they really are the future of the organization. And of course, those of you at home, I want to say hello and thank you to Carol Harrison Gallagher and her daughter Becky. And of course, I can't forget Frank and Shelley Haughton and their amazing family. And as I began, all of you here in New York, in Boston, and watching in your PJs from home, you are the reason that I and so many others remain committed and why we continue to give back to CTF year after year, helping raise awareness and money for this vital cause. It needs more attention and it needs more funds, but we will find a cure. Yes, we will. So with your help, we will end NF. That is not only my hope for tonight, but every single day. So thank you all so very much for this award, for being here and supporting this great, amazing cause. Thank you so much. Oh, I feel like it's my Broadway debut. Randy, everybody. Thank you, Randy. That was so sweet. But now it's time to turn it over to Ron in Boston. Ron, I hope you're having as much fun as we are.
We are, Raina, and congratulations to you. What a beautiful, beautiful award for a very special person. You really are a champion. You know, you touched on the word hope. There's a beautiful aria that Pavarotti sings, Nessun Dorma, and in that aria he talks about esperanza. Esperanza and hope, what you alluded to, that's what we all have in our hearts tonight. We hope for a cure. You're a true champion. So let's call out a few other champions who have made donations tonight. Let's give them a round of applause as I read their names. Barbara Franklin, Danielle Bonadress, Joe Schneed, Janet Gabio, Daniel Zawicki, Janine Den, Eric Shin, Debbie Falic. You're all champions. And a reminder to all of us, from all of us here in Boston, New York, and watching virtually, that you can truly be a champion by making a donation tonight to help CTF's vision of ending NF forever. Help us meet our match by donating now. Text us at NNF to 4144 or go to ctf.org/Gala or call the old-fashioned way 1-800-323-7938. We have people standing by on the telephone and in the room to help you make a donation. It's so easy with a phone call, 1-800-323-7938, and we can end NF tonight. As Frank Sinatra said, the best is yet to come. I'm really honored tonight, and that's the main reason I am here, to be in the same room as Leslie and Dick Cates to accept their Humanitarian Award from the Children's Tumor Foundation. Talk about true champions. They started working with the foundation 40 years ago, think about it, and have raised more than $4 million. Wow. In honor of their now adult daughter, Stacy, who's living with NF1. And for that, as Duke Ellington says, we love you madly. We really do. To tell you a little more about the Cates, please join me in welcoming Phil Schwaman to the stage. Phil?
Thank you, Ron, and thank you all for being here tonight as we honor the many visionaries who have led the way to incredible advances in NF research we have just heard about. Judy and I are so proud to support and be honoring two of the visionaries this evening, our dear friends of over 50 years, Leslie and Dick Cates. Leslie and Dick are true champions, visionaries, and humanitarians who have worked tirelessly over the last 45 years in honor of their daughter, Stacy, who was diagnosed with NF as a child and is now an amazing woman living a full and wonderful life despite her NF. 45 years ago, Leslie and Dick founded the Massachusetts chapter, and since then, they have worked nonstop to raise awareness of NF and raise funds from literally everyone and anyone they could talk to.
That's true.
That's Dick and that's Leslie. They are, without a doubt, relentless, determined, and generous. Most of all, Leslie and Dick want nothing more than to find a cure for NF, to bring new treatments to the forefront for NF patients, and to provide hope and inspiration to everyone living with NF. Judy and I could not be more honored to be here tonight celebrating 45 years of their tireless work. It is now my absolute pleasure to invite their children, Stacy and Matt Levy, and Alex Cates and April Ondas, to the stage to present the 2021 National Humanitarian Award to their parents. Thank you all.
Thank you.
Thank you, Phil and Judy, for your incredible support this evening, and to everyone here tonight as we honor those who are making a difference in the lives of patients and family members affected with NF. All of us on stage this evening, I'm Alex, my wife April, Stacy Cates, Cates Levy, and Matt Levy, could not be more proud and honored to present the 2021 National Humanitarian Award to our parents, Leslie and Dick Cates.
I was diagnosed with NF when I was 4, and at that time, there was very little known about NF. But my mom and dad did what they always did. They rolled up their sleeves and got in touch with the National Neurofibromatosis Foundation, now the Children's Tumor Foundation, and started fundraising, talked to medical professionals, researchers, friends and family, and those that they didn't even know, to raise awareness of NF and meet others like them. Through all the surgeries, the pain, the multiple doctor's appointments, and the continuous challenges, they've always been there beside me, advocating for me, supporting me, and never once giving up hope. You taught me not to accept no for an answer, keep persevering, be generous, open-minded, and take chances. For all those reasons and so much more, my husband Matt and I are forever grateful.
Over the last 40 years, they've raised more than $4 million for NF research and for the foundation through casino nights, cocktail events, dinner dances, walks, and runs. There was no idea that was too big or small for our parents, and our house was always filled with people planning, organizing, and eating snacks. They've supported, connected, and been a lifeline for other families living with NF from Maine to Boston to New Hampshire, California, Michigan, Florida, and beyond. They knew then what they know now. You shouldn't have to face NF alone, and they didn't, which is why we're all here tonight.
My parents' dedication, passion, and the belief in the mission of the Children's Tumor Foundation has helped people, not just like me, but everyone living with NF. Their efforts help the foundation support the very important preclinical studies, COSEL-UGO, the first drug approved for NF in April of 2020. Their continued commitment and perseverance will support the next treatments that are approved for NF1, NF2, and schwannomatosis.
Our parents' dream is our collective dream, a world without NF. Tonight, with all of you celebrating here in Boston, in New York City, and watching across the country, and because of the dedication of our parents, we are all one step closer to achieving that dream. Mom and Dad, I know you don't think of yourselves as humanitarians, just people who did what had to be done, but that's what humanitarians say. You began when the science of molecular biology was in its infancy and surgery was the only treatment. You kept working for almost 50 years, and your support helped bring about the new era of molecular therapies. So that's humanitarianism, and you deserve this award.
Video? Introduce the video. The video. It's going to be a small video.
There's a video.
Short video.
Stacy was 3 years old, and we had gone in. I had taken Stacy for an orthopedic visit, and the doctor had asked for x-rays and written on the diagnosis a disease that I had never heard, neurofibromatosis. And when I saw it, I immediately called a very dear friend whose husband was in medical school and said, what is, and God only knows how I pronounce it, neurofibromatosis. And she looked it up, and she said, Leslie, I'm not going to tell you.
It's been really hard for me. It's been hard because I've been called names. I can remember being on a tee and like people calling me, like people staring at me. And I mean, even if you're different in any way, people could look at you and call you something. People are cruel. Kids are cruel.
I'm a believer that you either put your head in the sand or you look up to the clouds and decide, I'm going to do something about it. and I've always been an optimist.
Don't say, well, other people will do it, because they won't. And the only reason why other people will do it is because it'll be a friend of yours. You don't know who the next donation will come from, who the next idea will come from.
I think our first fundraiser was a raffle. Then we had a Las Vegas night, and we finally had our black tie and an auction.
This is a family that really works together to straighten things out.
So I found out I had the disease, and I immediately founded the chapter. And to me, that just shows that how much they cared about me and how much they wanted to find a cure for the disease.
Together with your generous donations, we will be able to end NF. We are part of the CTF NF family, and we wish everyone well.
Leslie and Dick.
We need you on the stage.
Someone's phone, or is it?
Well,
Was someone just playing Reveille?
I certainly wasn't expecting that. Totally surprised. That was great. It was beautifully done. Wow. Dickie, you, he can come.
Let the games begin.
Wow. This is absolutely beautiful. Very, very lovely. I'm going to put this up here right now. What can I say? The momentum that kept us going for, and it was 45 years, is because of the encouragement of lots of people in this room. Our children are very, very wonderful family. Our loyal, hardworking, very generous friends. Our NF doctors and researchers, and all of you out there, our NF family here, New York, and virtual. And we cannot forget the professional, fantastic CTF staff and the person at the helm, Anita Bacher, whose vision has helped us finally found more treatment options to cure, to end NF. But we haven't done it yet. And I understand from a very good source that we now have another person, another donor that has come forward and is going to match up to another $100,000. That's what I've been told. And that's really something. But in order to have that happen, and I would be remiss if I didn't do this, it would not be me, if I didn't say to all of you, you've been so generous, you've done so much, can you do a little more? Can you dig just a little bit deeper? Can we come up with just some more money so that we really can end it? And there's nothing like starting first. when New York goes, or we're blessed with Ron helping us, then I need to first say, okay, Dick,
I was told not to say much.
what do you say about a little more that we start
I
giving?
was told not to say much.
But
we will give an additional $5,000.
Okay.
That's all I was allowed to say.
That's true. But he is wonderful. 60 years of marriage, so. And wonderful children, so a lot of blessings for sure. And thank you all for being part of it.
Thank you.
Give it up for Leslie and Dick. That's how it's done, right?
Absolutely.
Ladies? Yeah. And men? Just say whatever. Yep, not told to say much. Love that. Oh, it's me.
There you go.
I was so moved by Leslie and Dick, I forgot that I'm supposed to say something. And it's true, I was moved by their passion and dedication. And truly, Leslie and Dick, if you're watching, and I hope you're celebrating right now, but I hope you heard our sincere applause for you both, because 60 years of marriage, wow, number one. But number two, 45 years. You know, giving to CTF is quite incredible, and somebody backstage agrees with me. So let's give it up for Leslie and Dick, and of course their daughter Stacy. Thank you so much. So you heard Leslie speak about the reasons why you should give, and she said it quite eloquently, so I'm just gonna cut to this. To help us do that and raise awareness and raise funds, text END-NF or 41444 to ctf.org/gala, or you can call 1-800-323-7938. Whether you're here in person or joining us virtually, you can make a difference with a donation. I have to mention two very dear friends of CTF. This is a very true story. Shelley and Frank Haughton, hey to y'all in Montana. They are amazing people. Yeah, we're giving them a round of applause. Hey guys, and you're an amazing family. So I'm reminded as I stand here tonight of something that they said a few years ago, in this very room actually. And they said, it only takes $1, and that dollar could be your dollar that finds a cure. And it's really true. I mean, think about that. It only takes $1, and that dollar could be yours. So it's especially true right now. Oh, somebody's coming into my ear, Jonathan. What
could it be, Raina?
I don't know. Wait. Yes? Okay. That's my acting. It's not very good. But we just heard that Patrick and Rosemary Morris have pledged another $75,000 matching donation for the next $75,000 raised tonight. So let's do this. We got this. We can reach this match.
Yes, we can.
Okay, so we're trying for $1.5 million this evening, so let's bring it, people. Let's bring it. Keep drinking those drinks. Okay, so now let's shout out a few of our generous donors who have helped us get closer and closer to tonight's goal. Jonathan, take it away.
Ladies and gentlemen, third time's a charm. I got names for you.
Yeah.
John McKee, Dan Donoff, Amy and Bruce Gelb, Chris Pawala, Sandy Frenya, Lauren and Tom Bona, David Taub, Eli Dubby, Deanne Spiegel, Bill Brooks, Vicky Matsuna,
Woo, Vicky!
Liz Rodbell,
Liz!
Amanda Jaffa Maknovich, Patricia Potosnik, Riley Bruce, and Nicola and Robert Bronin.
Yeah.
Thank you so much for your generosity. Thank you to everyone who has donated so far tonight. Together, I know we're gonna meet our match. And now I am so delighted for our next and final award, the National Ambassador Award. It is the most special part of our evening when this year's ambassador passes the torch to the next. Now, the National Ambassador is an individual who speaks on behalf of the foundation, telling their story to inspire others. To present the 2022 National Ambassador Award, please join me in welcoming my dear friend, the 2021 National Ambassador, the lovely Lily Ann Brooks.
Good evening, everyone. I want to thank each of you for being here tonight. It is so wonderful to see your amazing faces in person. I'd also like to thank everyone tuning in online from across the globe. Your support means the absolute world to me. This year, I have had the honor of serving as the 2021 National Ambassador. While this year has been unconventional, I have been truly blessed with this opportunity and the events that I've been able to do virtually. My goal as ambassador was to show everyone with NF that it does not have to define who you are or what you can accomplish. I made that decision very early on in my life, and I believe that that has made all the difference. I've done things that many said that I would never do. I attended university. I made the dean's list. I live on my own. I have a professional career, and thank you. And I live a fairly normal life. When people said that I couldn't do things, I proved them wrong. When the bullies knocked me down, I got back up. When I felt defeated, I reminded myself of all the things that I have done. To everyone living with NF, you are strong and you are worthy and you can do anything you set your mind to. I owe much of my positive mindset to my amazing people that surround me in my life. So I'd like to thank my parents, Bill and Candy, my brothers, Kyle and Lee, my sister, Elizabeth, and my amazing friends. Each of you constantly supports me and constantly uplifts me, and you push me to be the best person that I can be. I would also like to thank the Children's Tumor Foundation for giving me this incredible opportunity, and especially Suzanne Earle, who nominated me for this award, and everyone else who nominated me. I would also like to thank each person who has donated tonight. Your support means the absolute world, and it is the reason that we are getting one step closer to a cure. It has truly been a dream come true to be able to have this opportunity and to share the advancements of research with you all. It has been my honor to spread awareness and to raise money with the hashtag EndNF and to make NF visible to everyone. I now have the opportunity to introduce to you an absolutely amazing individual. He constantly pushes the boundaries and breaks through barriers. His story is an inspiration to us all because he has overcome every obstacle that NF has thrown in his path. He is truly an ambassador for the NF cause and an example of the way each of us can live our lives. I will leave him to tell his story. Please welcome your 2022 National Ambassador, Eddie Purtell.
When Eddie was born, we knew he had glaucoma, and he had 3 surgeries in 4 months. One of his doctors came to us after the 4th month and said, "We think he might have neurofibromatosis."
I was diagnosed with NF type 1 when I was 4 months old, so I didn't really understand until I was probably 7 or 8. So by then, I had already had multiple surgeries and had my left eye removed.
Basically, they've just debulked tumors throughout the 15 surgeries he's had. The major surgery, Eddie was cut from ear to ear over the top of his head. They peeled back the skin. They took out a piece of his skull, put bone paste in, and metal mesh. Then they stitched him up. And one of my favorite stories was 5 days later, Eddie is jumping off the high dive into the pool, and I was concerned his stitches were going to rupture. But he was fearless.
I don't really tend to think about on a day-to-day basis about me having NF. I just, live life as much as I can, I go skiing and hiking a lot. It hasn't really stopped me from doing much. I've done, I think, 13 half marathons and 1 marathon.
When he was younger, I was always afraid that other kids would pick on him or make fun of him or just kind of not understand some of the challenges he faces. So I was always just really anxious and worried for him, but he was fearless and he also was a bit rebellious. Eddie was very, very stubborn as a little kid and didn't like hearing no.
Ready? So 10 miles today?
3 miles. No, you're not going to bump me.
I don't think I ever really had a bully. People have definitely made fun of the way I looked before. It didn't really affect me too much because I had so many great friends that I just kind of ignored it. My only really struggles in school were academically. I was able to make friends pretty easily and played sports. My main sport was soccer. I played that pretty much my entire life. And then lacrosse I kind of picked up at school.
Eddie grew up with NF. It's all he ever knew. And so we just treated him like any other kid. He played sports, hockey, and soccer and lacrosse. And that's really where he started running and started doing the half marathons and raising money for Children's Tumor Foundation with Ned.
My dad and I still run together a lot. When I'm back home, we'll take our dog and run her down to the beach. And my dad is still doing half marathons with me at 60.
One of Eddie's teachers coined the frame that Eddie's going to get to the finish line from a different angle. And I think that is very true. You just have to keep faith that, you'll get there. Eddie has never once complained about it to us or asked us the question why, which I think is probably something that I would say that I've learned the most. Things happen, you just keep moving, which has kind of been his MO.
And then he went on and he graduated 4 years, got a scholarship at DU, graduated in finance in 4 years, and got a job on his own with no help from us.
Guys don't look too good, do they, Eddie?
Given everything that Eddie has gone through, I think it's really shaped our relationship as siblings, and it's a super special bond. Growing up, we've traveled the world together, and I'm really grateful to have a brother like Eddie. He's super sweet, kind, protective, really funny, and just really fun to be around.
Raising funds for the Children's Tumor Foundation has really meant a lot to me, and I hope one day that a bunch of you took here and are at least more drugs that can help combat some of the difficulties that people with NF have to face. So when I found out that I was the 2022 CTF National Ambassador, I was very honored. I hope that young kids and parents of young kids with NF can look at me and see that even if you have NF, you can still accomplish a lot and go on to live a great life. Hello, my name is Eddie Purtell. I'm truly honored to be the 2022 National NF Ambassador. I grew up in Milwaukee, Wisconsin,
and currently live in Denver, Colorado. I want to give a big shout out and thank you to everyone in Wisconsin who has supported me over the past 10 years of my life and in my fundraising efforts. My NF journey began day one. I was born with a tumor behind my left eye, and by 4 months old, I was diagnosed with NF1. Throughout my childhood, there were multiple surgeries and MRIs to monitor tumor growth. Then, when I was 8, I had a 16-hour surgery with 3 surgeons attempting to debulk the tumor in my head. This resulted in 52 stitches over the top of my head. I did bounce back pretty quickly. In fact, 5 days later, I was jumping off the high dive at the pool. Sorry, Mom. The next 20 years involved many more surgeries and more monitoring. I've had over 20 procedures in all. In addition, I had learning differences in school, and dyslexia caused me to need to repeat the 4th grade. This started a pattern of teachers not believing me during middle school. However, one tutor, Miss Seamers, did believe in me. She always told me, "You will get to the finish line. You might just need to take a different route." In 8th grade, my parents and I found out I would not be asked back to attend high school at the school I'd gone to since kindergarten. This school told my parents I should go somewhere where I had a chance to graduate high school. I had to leave the only school that I had ever known and all my friends behind and go to a different school in a different state. Of course, I was not happy with this. I enrolled in a boarding school that specializes in learning differences, the Gala School, where I continued to play sports and work my academics. By sophomore year, I was starting most games on the varsity soccer team. During the summer, going into my junior year, I decided to start running more to prepare for soccer. And just like that, I started running. I put on a t-shirt, some athletic shorts, socks, a pair of running shoes, and grabbed my iPod. One day, my run went longer than usual, and when I got back, my dad asked where I went. After describing my route, he exclaimed, "Eddie, that's probably 6 miles." I figured if I run about 6.5 miles, how much harder could it go twice as far? So I signed up for the Chicago Rock and Roll 2011 half marathon. My first half marathon to this date is my worst time to finish because I had to make a pit stop mid-run and just so happened to stop where there was 1 porta potty and 4 other people in front of me. So this probably added 15 to 20 minutes of my time, just saying. Since that run, I have started to do an endurance event almost every year. During the summer, before my freshman year at the University of Denver, I had reconstructive jaw surgery. The doctors estimated this would be about a 7-hour operation and my jaw would be wired shut for about 4 weeks. So I figured I still had a chance to run a half marathon, as I was still in running shape. It turned out my jaw was wired shut for 7 weeks, so I decided not to sign up for the run a half marathon. This has been the only year I did not do an endurance event since my running career started. However, I did start doing short 3-ish mile runs approximately 2 weeks after, with my face still swollen and jaw still wired shut. Every time I have had surgery, my first question after waking up from anesthesia has been, when can I start running again? At the University of Denver, I was a part of a social and business fraternity and graduated on time with a bachelor's degree in finance. I now work at Promontory, a division of IBM, as an analyst in anti-money laundering. To this day, I have run 14 half marathons, 11 of which have been to raise funds for CTF and the Chicago Marathon. So far, I have raised over $130,000 to find a cure for NF. I was invited to join CTF's Volunteer Leadership Council in 2015 and attended my first forum in leadership training in Austin, Texas in 2016, and have been part of the VLC every year since. I also attended the conference in 2019 in San Francisco. In addition, in 2020, I was invited to join CTF's junior board. None of this would have been possible without the supportive family, the great people of Wisconsin, and my best friend, Shelley Haughton, who supported me unconditionally throughout. A question I would pose to others living with NF is, what if it could turn out better than you could have imagined? If back in 2011, if I hadn't taken a chance to start running, I would have never achieved all I have today. I may have never started fundraising for the genetic disorder I was born with. I may have never become the CTF Junior Board, and I may have never been honored here tonight as the 2022 National NF Ambassador. I hope hearing my story will not only encourage others to get involved in a great cause to come up with a cure for NF, but more importantly, others with NF can get encouragement from my story. As it was said to me early on, I had to take a different path to achieve my goals, and so might you. Thank you, and I hope everyone has a great night.
Congratulations, everybody. What's that?
Cards first?
I think we go right in. Yeah, we'll just go through this.
Okay. Oh, it's me.
Yeah.
I'm so excited. This happens halfway through the show. So Jonathan, I don't know about you, but Eddie and Lillian truly, honestly, are two of the most amazing ambassadors for our cause. I believe we also have a few former ambassadors who we've talked about earlier in the evening. Rose Matsuno, whoop, whoop. Where are you, Rose? Where are you, Rose?
Over there.
And where's Rose? Oh, hey, Rose, you beauty. And McKinnon Galloway, yes, McKinnon. Oh, McKinnon is not at her stage. Oh, there she is. She's always missing her cues. And oh, is Brianna Warden here also? Oh, watching virtually. Hi, Brianna. We love you, Brianna. Thank you for all your good work. So these guys, as Jonathan and I said earlier tonight, are the future of the CTF Foundation and the organization. So they're all here tonight. So round of applause. Yes.
And ladies and gentlemen of the Children's Tumor Foundation, don't forget you can still make a donation to help us reach our goal of $1.5 million raised and meet our match. Now, more cards. Woo! Let's thank a few more of our sponsors. Mady and Bruce Donoff, Jim and Hala Solomon, Nicholas Folk, Roxy and Brett Diamond, Taylor Manchester, Jason Hayes, Timothy Ward, Tila Levi, Christine Poyea, Libby Mansell, Linda Brodsky, Dan and Norma Frank, Laura and Anthony Perfetti. And ladies and gentlemen, I just want to tell you we have an update that I just received.
Stop it.
No, put your hands together, ladies and gentlemen, because as of right now, we have $1.6 million raised.
Woo! That deserves like a little dance from you. Can you tap?
I can't.
Come on. That deserves something from this Hollywood
My mom didn't put me in
star.
tap dancing. She made me wrestle instead. It was weird. So don't forget, it's simple and easy to make a donation. You can text NNF to 41444 or go to ctf.org/gala. Do it the good old-fashioned way. Dial 1-800-323-7938. Ladies and gentlemen, are you ready?
I'm ready. You guys, you got to be ready. Like, seriously? Like, put down the food.
Here we go.
Put down the drinks.
This is important. Ready?
Yes.
Live from New York, it's the Mayor of New York.
Put your hands together for the Mayor-elect Eric Adams! Woo! Woo, woo, woo! Hello, Mr. Mayor. We are so happy to have you. Woo!
In order, they should have stated, in order to get the right applause, you have to say the future Mayor of New York. Let me say this. When I heard the numbers of $1.5 million, I was not supposed to be here tonight. I saw Gabriel, the mayor in Bell Harbor. I saw him last night, and he told me about this amazing event. And I stated I wanted to just stop by and just really thank you. And sometimes we don't know when we are blessed and elevated to a next level in life, we're supposed to pass that blessing on. I believe in all my heart that there's a social bank to our universe. And when you deposit in that bank, you are given the opportunities to draw on the equity when you find yourself in a certain circumstance. And these amazing parents, amazing children, they have learned how to turn pain into purpose. And what you are doing tonight, you are saying something my mother said to me as a child. If you are fortunate enough to live long enough, you're going to find yourself in a dark place. You make the decision if that dark place is a burial or a planting. Your dollars are saying to these children that this is a planting, this is an opportunity. And as we pass on this blessing to each other, we're going to find ourselves to be really living out who I believe in all my heart. We are not physical beings. We are spiritual beings living in a physical moment. We are so much better as a country and a society. And there's a question mark that lingers over our country. People are asking from every corner of this country, are we going to be all right? When you show up and you give to people you don't even know, you take that question mark and turn it into an exclamation point. We are all right. We will be all right. We are the greatest country on the globe, and we're the greatest race alive, and that's the human race. Thank you so much for what you have done.
He predicted the next president.
Thank you so much for coming by.
Wow, thank you so much. Jonathan just said it, not just the future mayor of New York, but the next
President, man, he's got it.
Thank you so much. Mayor-elect Eric Adams, thank you for being here. Wow, that does it. Ending on a high note. So thank you all also, truly all of you, for being here tonight, from Boston to New York to all across the world. We are so pleased to share in this wonderful evening with all of you. So thank you.
And as I stated before, thank you to each and every one of you, the friends and family of the Children's Tumor Foundation. Through your continued generosity, tonight we raised $1.6 million. Thank you, thank you, thank you.
Yeah. And Ron, thank you so much for being with us in Boston. We love you all. Boston, too. What team did they root for? The Patriots. Yeah, we'll forget about that part. Anyway, thank you all very much, and we hope you enjoyed the evening. Oh, Ron is with us. Oh, hi, Ron.
Guys, fabulous. Jonathan and Raina, you guys are something else. What a great night, a night we'll remember for a long time, and the future mayor of New York. Wow, you really did it. So we want to say thank you for inviting us from Boston and all of our wonderful people here, including Leslie and Mr. Cates. Yes, he's here too. Thank you so much. And we'll have a good time. The best is yet to come. Well, how about that, ladies and gentlemen? Leslie and Dick Cates. Leslie and Dick Cates, this was your night. This is your life, as Ralph Edwards used to say. What a great, great presentation, and seeing all those wonderful people. And this fight goes on, but you know something? We're within the finish line. Thanks to you guys, you've been terrific with all your support. $4 million when you started, and all the time and effort you put into it, and the love people have for you in this room is so palpable tonight. Thank you, Mr. and Mrs. Cates. We love you madly. And good night from Boston.
I want you to see me and to see NF.
I want you to see me and I want you to see NF. My name is Caitlin. I want you to see me and see NF.
I want you to see me and see NF.
I want you to see me and see NF.
Make NF visible.
Thank you.
Well, what happened, I just wish people would
stop seeing the NF and see me for who I am.
I want you to see me and I want you to see NF.
I want you to see me and see NF. I want you to see me and NF.
I want you to see me and see enough.
We want you to see us, and we want you to see NF too. I want you to see me and NF.
I want you to see me and see NF.
I want you to see me and see NF.
I want people to see who I am. I want people to see what NF is.
So I want to work with the Children's Tumor Foundation to make NF visible.
I want you to see me and NF.
But I want you to see me and see NF.
See Addison and see NF.
I want you to see me and see NF.
I want you to see me and see NF.
I want you to see me and I want you to see NF.
We are, stand in the light and be seen as we are. Right in the storms that come raging toward us, we die. Holding our breath as we break through the surface with arms open wide, with arms open. This is who I am inside. This is who I am. I'm not gonna hide. 'Cause the greatest risk we'll ever take is by far to stand in the light and be seen as we are. Stand in the light and be seen as we are. Stand in the light and be seen as we are.